Hello, everyone, and welcome to Addressing Body Image Struggles as part of Breast Cancer Best Practices. We're glad you could join us. My name is Elaine Gonzalez. I'm the community educator at the Breast Cancer Resource Center, or BCRC. I'm pleased to serve as your moderator today. The Breast Cancer Resource Center, BCRC, is a community-based nonprofit serving Central Texans impacted by breast cancer since 1995. Strengthened by our mission to empower those affected by breast cancer with personalized support and compassion, and in collaboration with our community partners, BCRC envisions a future where no one faces breast cancer alone. BCRC offers individualized patient-centered care for diagnosis through treatment and into survivorship. Through its two pillars of support, guidance and education, BCRC certified patient navigators, whom all are breast cancer survivors themselves, empower those touched by breast cancer to become active and knowledgeable participants in their healthcare journey. This program is provided as part of a cooperative agreement awarded by the Centers for Disease Control and Prevention to expand our programs for young women. The purpose is to increase the availability of support services for young breast cancer survivors, young women with metastatic breast cancer, and their caregivers and families. And this CDC funding continues today. We are so honored to have with us today Dr. Michelle Fingeret with Fingeret Psychology Services. Thank you, Dr. Fingeret, for joining us today. Will you please join us on screen to share your presentation, and then I'll turn things over to you.
Hi, everyone. By way of a quick introduction to everybody, I'm a clinical psychologist, and I have built my entire career around caring for adult cancer survivors with body image struggles. It's something I'm very, very passionate about. It's something that I found as a natural extension of a lot of the training and research that I did just in the general area of body image, and I felt as if there was not enough for cancer survivors, both from a research perspective as well as clinical services perspective. And so I was very excited to have an opportunity to be at MD Anderson Cancer Center in Houston, Texas for many years, over a decade, where I was I was on faculty there. I was a postdoctoral fellow and then an assistant and associate professor, and I built up what I came to name as the Body Image Research and Therapy Program. And I had fellows that worked as part of this program with me, where I trained other psychologists and how to deliver body image care. And I not only worked with breast cancer survivors, but also with patients with other cancers as well, head and neck cancers and other things. So today I'm going to share with you kind of a culmination of work that I've done over many, many years. I am now in my own consulting practice, where I will tell you a little bit more about that later, but I've kind of taken all the work that I've done in academic medicine and gone into more of a private consulting setting at this point. So let's see, I'm going to go on to the next slide here. Okay, so today what I hope to be able to do is to talk about provide you all with some foundations of body image for breast cancer survivors, give you a nice framework. I want to talk about some best practices for how to approach conversations about body image during clinical encounters. I am been told that this is a very multidisciplinary professional audience, which I love, because there's a lot of things that all different disciplines can do to help support body image care for breast cancer survivors. And a lot of these things work across professional disciplines. I want to talk about some very specific content areas for clinical assessment of body image difficulties during a clinical encounter. And then I want to give you a very broad overview of some basics of body image treatment. It will be hard to do this in 45 minutes, so I'm going to do my best and touch on these areas. There's obviously a lot more in depth I could go into each of these topic areas. But what I really hope you will leave with today is some very practical tips and strategies that you can use as part of your clinical care activities. So by way of disclosure, I do receive royalties from Oxford University Press. So the first thing I like to do when I give a talk such as this is I really like to talk about what is body image? How do we define it? When you look in the scientific literature, you will find lots of different definitions, but I want to get everybody on the same page where we're starting here. So the way I see body image is, sorry, that went a little too fast, is the personal relationship you have with your body. And that's a really important element here. So obviously, whether you're a healthcare provider or you're a survivor or both, everybody has their own body image experience, right? But when we think about body image, it's very multidimensional. It's the way you think, perceive, and feel about all aspects of your body. And so when you think about it in this very broad way, it's not just about physical appearance or how you feel about the way that you look. That is an important component of body image, but it is much beyond that. We know that there are sensory aspects of the body, functional elements of the body. There's all different ways our bodies operate and work. And so we have to think about it in that manner. And of course, when we're putting it into a context of breast cancer, we understand how there's lots of different aspects and components of body image that are affected by this illness and its treatment. Another really central component when looking at body image, understanding that it's completely subjective. It is all about, for the breast cancer survivor, what she sees or how she experiences her own body image. And when we look at it in that frame, we have to understand that more often than not, there is a disconnect that exists between a way a patient experiences her own body image and other people. And that could be disconnects between the patient and her spouse, or a patient and her loved ones, or patients and their healthcare providers. And we see this time and time again in the clinical setting. And so we really have to honor that it really does not matter how anybody else sees this. It only matters how the patient perceives and experiences their own body image. And that's what we have to try to understand as healthcare professionals. And another piece that's critical to understand is that body image can change over time. And I'll talk about this quite a bit today to understand that there are some individuals who are going to come into the cancer setting very have a lot of anticipatory anxiety about their body image, and others may not. Others may not be focused on that at all. And it might not be until later on in treatment that this comes up. And we'll talk about how that plays out. And I'm sure a lot of you have experienced this with your own patients and clients. But just think about for yourself, what are the things that can affect your body image, even in the course of a given day? How tired you are, what you've had to eat, how much exercise you've had, how hydrated you are. So if body image can fluctuate in the way that you experience your body in a given day, imagine how magnify that by what's going on when you add in all of the effects of cancer and its treatment. So some basic, concepts here about what are things that influence body image. Personal background, obviously there's a whole body image literature outside of the field of cancer, a much broader body image literature that talks about the influence of gender identity on body image, age, cultural beliefs, family messages surrounding body image, individual physical characteristics, things of that nature. There's a lot of societal influences, societal ideals regarding appearance and fitness and the thin ideal, things like that, mass media, social media. What are all the messages that we are given about bodies and ways bodies, should look? And then, of course, what's really at the heart here is understanding that within that, there are these external events that further affect body image. And of course, the external event that we're talking about today is breast cancer and its treatment. So, the way I like to frame this is to understand that all breast cancer survivors undergo a process of body image adaptation. They all must figure out a way to adapt to some change that is going on with their bodies. Those changes can be big or small, visible or not visible. There's lots of different ways the bodies are affected. So if we just frame that this is a universal experience, I think that helps as a very strong foundation here. And what we know from the literature just in general is that body image issues, or the way one adapts or adjusts to body image changes, are not based on the location or extent of cancer or the location or extent of any kind of a medical illness. We cannot predict who is going to have these body image issues just based on how severe or at what stage or what type of treatment a person is at. Because we can have two people with the same exact type of treatment characteristics, and their body images can be very, very different. Some people adapt and adjust very, very well. Some adapt and adjust very, very poorly. And we really have to be able to work on an individual level of how we're going to do this. So we don't want to make any assumptions going in, right? I think that's a lot of what I see sometimes with healthcare providers. And many of you probably know this, where, kind of the assumption is that a patient that's having, both breasts removed and very extensive, reconstruction, that person is going to be at much greater risk of having body image dissatisfaction than somebody who might be having a segmental mastectomy or have a very, small, not visible changes to their breasts. And again, that's not the case. So I kind of will repeat this again, the idea that body image concerns can arise prior to, during, and or after treatment. It's really important because what this suggests to us is that we must continually assess body image. Just because a patient's coming in at the outset of treatment and not focused on body image at all, maybe they're just focused on their survival and all these other kind of aspects and things. And when those body image issues come on later, it's actually much harder for patients to then engage with their healthcare providers around these worries and concerns and things that have cropped up, because they feel more guilty and ashamed that they weren't, that's coming up now, and even surprised and shocked at times, right? So we need to be able to look at this across the whole treatment trajectory. And then really in the end is helping to again and again explain that body image concerns are completely normal and to be expected. So I tell you, when I go in to see a patient, I used to do this when I worked at MD Anderson, I would go in as part of the team. And I would say, I'm a body image specialist. I would not lead off with saying I was a psychologist or a mental health expert. I would say I'm a body image specialist. And what that means is I help patients who may be having concerns about changes to their bodies as a result of breast cancer and its treatment. It is normal and common to have these experiences. In fact, most patients will have concerns about body image, and I frame it in that way. And if that is literally that is like the most fundamental and core intervention, it seems basic, it seems easy. It's impactful, and you can do it again and again and remind people again and again how normal and common this is, and it's okay to have these concerns. And I'm probably going to beat that drum a lot today. Some other considerations we have to look at are whether or not the changes are gradual versus acute. Obviously, patients can have both gradual and acute changes depending on what type of treatment they're having, whether the changes are temporary or long lasting, and the uncertainty of that and dealing with that is really, really important. Late effects, whether the changes are visible or not visible, because there's a lot of not visible changes that we must address as specialists in kind of working in the oncology setting around providing body image care. And then, of course, understanding and being really keen to try to be attuned to our patients feeling guilty or embarrassed or having reluctant to share about this because they're feeling some degree of shame. And a lot of that is because they don't want to bother their healthcare providers. They don't want to seem ungrateful. There's a lot of reasons why women can have a hard time coming forward with this, or just minimizing or downplaying. So I give you like my list of some common types of body image concerns for breast cancer survivors. And when you look at this, you can see some of these relate to physical appearance, like scarring or disfigurement or swelling, skin discoloration, hair loss. But others of these are not visible and are not about appearance, sensory changes that could be very distressing for patients who have loss of sensation or numbness or pain, fatigue, obviously fertility issues and sexual dysfunction. These are very distressing elements of body image, whether they're having weight gain or weight loss. And then a big one I talk a lot about with people that I think is not very appreciated as a body image concern is having decreased physical strength and stamina. So I'll just kind of go back. When you look at this, you can see why this is such an important area for us to address. Look at all of the different ways that body image issues can manifest themselves. So I'm going to spend a little bit of time on this framework for you. And it's a way to really understand what does it look like when somebody's having body image concerns and how can we best conceptualize this? Well, I'm going to start in the middle of this continuum. And this is where most survivors will be. They will have average or normal body image concerns. What does that mean? It means that they will have mild to moderate difficulties adjusting to body image changes. It could be that at times they're having intrusive thoughts about their body image changes. It's difficult for them to take their mind off of these thoughts, and it causes them to feel distress. But this is not an all-consuming situation. It's coming up in certain situations, okay? They're likely to feel somewhat self-conscious in social situations, and they're likely to have difficulties coping with body changes. This is all normal and to be expected. But one of the things that sets this group apart is that these patients tend to have more realistic or flexible expectations, and they're not necessarily significantly limiting or avoiding activities due to their body image concerns. Even these individuals can benefit from supportive therapy. Just because the concerns are to be expected and normal doesn't mean that we can't facilitate coping and adjustment for these, because it can still be very distressing. Kind of at the right end, you'll see where body image concerns are much more extreme. They're much more interfering with daily activities. The degree to which they're having intrusive thoughts about body image discomfort may be daily, lots of hours of the day spent in being concerned or consumed by body image concerns. They might be engaging in a lot of avoidance or isolation due to those concerns, likely to have more clinical levels of depression or anxiety, or potentially even suicidal ideation. And these are individuals who are likely to have much more unrealistic expectations for their outcomes, and that can be really challenging. And for sure, these are individuals who could benefit from intensive therapy delivered by a mental health specialist. But let's not neglect the left side of this continuum, where you have patients who say, I'm not concerned about body image change. It doesn't bother me. And it could be that there is a subset of individuals who are just not invested in their appearance or these body changes, or they may have very positive adaptation to their body changes. They have their scars as a badge of honor. You know, there's something about this where they're having positive growth from this experience. But I would argue that there's going to be a number of individuals who really are minimizing their body image concerns because, as I've mentioned already, they're hesitant or reluctant to acknowledge the difficulties. They feel ashamed or embarrassed or guilty. And if we can help normalize and validate that it's okay to have these concerns, we are more likely to actually understand that they're having either average or normal, or maybe even more extreme body image concerns that we didn't know about before. So, how do we start these conversations about body image? I want to spend some time on this. And I will tell you that there are a number of kind of articles and things where I've laid this out a little bit further, which you can find, have some resource information on my website. But this is a model that I have published a lot about. It's called the 3 C's. And I already kind of demonstrated for you at the beginning of the presentation when I gave my spiel about, hey, I'm a body image specialist. Here's what that means. And I start off the conversation with all of my patients before I even ask them questions is normalizing and validating the body image concerns. It's common and normal to have these concerns. I think I say a lot to people, it's more normal for you if you have body image concerns than it is if you don't, if you're a breast cancer survivor. And then the next part, the next C, which is really a very open-ended way of asking, what, if any, concerns are you having? And you can ask about appearance, you can ask about functional changes. I'm going to actually give you some specific domains you might be able to ask to get at what the body image concerns are. But for now, you just start with that open-ended. You want to know what's top of mind for these individuals as they're, whatever stage of treatment you're getting them at, right? It could be the beginning, middle, could be a late-term survivor, long-term survivorship, doesn't matter. You just want to know what's top of mind. And you can explain that body image is not just about appearance, but also about physical functioning and sensory changes. And then you want to know how's this affecting your day-to-day life? You can probe for things like, how is this affecting your relationships? How is it affecting you at work? How is it affecting your emotional functioning? And you can do this in a clinical encounter in just a few minutes. You don't have to spend a lot of time on this, but you want to be the one who's approaching the conversation. You don't wait till people come to you and say, oh, by the way, I'm having all these concerns. You want to be able to elicit this. So that's the framework that I use, which really can take just a few minutes in a clinical setting. And if you are, a mental health specialist who has a lot more time to devote to this, sure, you can probe and go further into that. So how about what not to say? How about that? I can tell you from having worked in a hospital setting for many, many years that what I hear the most common when the healthcare team member walks into a room, and this is with a breast cancer survivor who's at whatever stage of treatment, maybe they're coming in post-op, maybe they're coming in for a follow-up. And the first thing that often comes out of the healthcare provider's mouth is, you look so great. And I can tell you that what that does is, if that patient is having a lot of body image concerns, it potentially has the impact of just shutting them down, right? I don't feel like I look great. I don't know how much I'm willing to share this with the doctor now because they think I look great, or the nurse, or the physician assistant. And it's kind of a knee-jerk thing. And by the way, they're getting this from their family and friends also a lot of times. You look great, you look great, you look great. And so what I do is I really try to dial that back, and I say, okay, let's not comment on appearance. at the outset of an appointment. Now, there may be some important ways that you want to educate or reassure patients about the fact that their healing is going well or their outcomes are favorable. There's time for all of that. The first thing you want to do, though, is you really want to get at how is the patient experiencing their recovery, right? And to take some time to really empathize and explore and give that patient the opportunity to talk about any of their body image concerns, right? And you can always educate, reassure, provide information, but you don't want to do that at the outset because it does have a way of just shutting down that conversation, and you will not get what you need to know, hey, does this patient maybe need a referral to a mental health provider? Are they really struggling? Is there maybe an intervention I can do in here that can help them feel better? But in order to get them to feel better, we first need to understand where they're coming from and what their challenges are. And so, look, I think we all know about the concepts of empathy and exploration and reflection. It is hard sometimes to put that into practice, admittedly, if you have a very small window of time, if you're in a clinical encounter. But I think we're also so quick to want to be hopeful and all of that. There's time for that as well. So I just kind of give that to you, these kind of really key areas: empathize and explore before you educate, and reflect before you reassure. Okay. I'm going to move on because I could say a lot more on that, but I have a lot more things to cover today. So this is, if you had to pick out, you don't have to do all of this, by the way, if you're going to do a clinical assessment of body image outcomes. And depending on where the survivor is in their care, you might pick out a few of these. But the very first thing that you want to do is you really want to be able to talk with the patients about the importance or the meaning of their affected body part. Really get at that, because if you can understand that, you're going to be in a much better place to provide interventions and to make referrals and other things that you need to do. It is worth having that conversation and being proactive about it. But I would say some things you can do is you get the patient to describe the body part that's been affected, and you listen. What is the language that they are using of how they are describing themselves? That's a really key thing to pay attention to. So as an example, I have patients that tell me about their frankenboobs, or that they look hideous, or that they look like, a monster, and I'm obviously giving you the most extreme examples here. There's obvious ways that people can talk about this in a less extreme way, but those are the ones that stand out in my mind as I'm giving examples. But I want to hear that language. I want to know, tell me how your body has changed. Were these changes expected or unexpected? How so, right? What are your expectations for future changes to the body? And then you can get into maybe understanding a bit more about how much time they're spending thinking about their body changes, how much distress they have. Are they avoiding activities due to body image concerns? And what activities are they avoiding? Okay, I'm going to give you another example here of, women I work with who won't put on bathing suits, understandably, but bathing suits can really be a big body image trigger. But it's preventing them from maybe swimming with their children or their grandchildren and getting that kind of enjoyment. And so we really can get at it in these different ways. You want to know, are they engaging in a lot of grooming, spending a lot of time putting on makeup or clothing or trying to camouflage things, or are they avoiding this altogether? You should get a pretty decent sense of how much reassurance seeking they're doing. If they're doing a lot of reassurance seeking with you as a healthcare provider, that should be kind of like a ding, 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 right? We should look at this more. And then, of course, talking about concerns about sexuality and intimacy. Okay, having a hard time advancing. Okay, let's talk some more now about the basics of body image treatment. I think about this in 3 phases. First is my role as a body image specialist is helping facilitate treatment decisions related to body image when someone is really struggling or having a difficulty making certain decisions. There's other interventions that I would use if I'm trying to help people cope with recent body image changes. And then there's other interventions I might use if I'm trying to help promote long-term body image acceptance. And realize that for breast cancer survivors, they can cycle through, go back from 3 all the way back to 1 again when a new treatment starts, right? Whether a new phase of reconstruction, or if they're going to be doing radiation, or whatever it is, we may have to go through this whole process all over again. So facilitating treatment decisions related to body image. And it would be like this for, at the core of this is really normalizing and validating a patient's body image concerns. That is really helpful when somebody's struggling with somebody, is to really give them the message, it's okay that you're struggling with this. There's nothing wrong with you because you're struggling with this. And I do try to work with people a lot on helping them clarify their goals and values. And sometimes their goals and values may be different for what they value in terms of their body image and what they value or what their goals are for their cancer treatment. And when those two things conflict, right, we need to have some conversations about that. A lot around promoting autonomy and choice. As long as the patient is informed of all of her, the advantages, disadvantages of the different treatment options, I am not here to push them in one way or another, which includes whether or not to have reconstruction, whether or not to have surgery at all. Right? I am there to provide a safe space for them to explore these treatment options and empower them to make decisions based on their goals and values. And then another part is, how do you help set realistic and flexible expectations for outcomes? So as a psychologist, I don't get into the ins and outs of what scars are going to look like or what to expect from an outcome. What I will do is kind of give my little spiel, which is, listen, you're going into this and you have an idea in your mind of what you think you're going to look like. And that could be, and I'll get into this in a minute, I don't know how much kind of information seeking you're doing and whether this is from reputable sources and how many pictures you're looking at, what you're seeing on the internet and which friends you're talking to. But whatever it is, you have an idea in your mind of what to expect, of what you think is going to happen. And I can almost guarantee you that it's not going to turn out that way. It's either going to be better than you think, or it might not be as good as you think, or there might be some aspects that are better or some aspects that are worse. Either way, from the beginning, from day one, you need to be prepared to adjust along the way. Okay. And so that's kind of a very basic conversation I have with pretty much all of my patients, because most of the people who come to me are known to have body image concerns and issues, right? So I've talked about this already, validating and normalizing the concerns. And I would say, even if you have patients whose concerns are so extreme, right, that they're so consuming and they're so distressing, maybe the nature of their concerns are extreme, you can still tell them the fact that they have the concerns at all is normal. It's just the degree of their concerns may be more extreme than other individuals. And again, that just helps kind of depathologize all of this, right? And you really want to be the safe space for them, because they might not have that safe space with some other healthcare providers. And you really want to help make sure that whatever it is you are talking about gets communicated back to the treatment team, whether that's you, if you have an agreement to be able to talk to the team, or you're empowering your patient to go back and talk to the team. So look, again, I'm giving some extreme examples of patients coming in and saying, oh, I want to have a surgery where there's no scars. I don't want any scarring, and there shouldn't be any scarring, or they can hide all my scars, or not, the next surgery is I need to fix. Whenever somebody talks about fixing things, I always, like, my little antennas go up. And then of course there's this whole idea of, oh, I'm going to get my new boobs, or I'm going to look better than I did before. And I pay attention to these at the outset, or oftentimes you can hear this right in the midst of treatment, where they're going to have another reconstruction or a revision surgery. And it's all about fixing and looking better. And again, it's balancing the hope with realism and figuring out how to do that. I'll give you some of my biggest tips for how you as a healthcare provider can help manage expectations. Very important is, number one, learn about what a patient is most concerned about or focused on. If you can understand that, then it helps you when the expectations are not being met, because that's what they're going to be drawn to, is the things that are the most meaningful and important to them. So continue to have those kinds of conversations. Hopefully now we're at a place where people can be bringing loved ones back again into in-person appointments. You want to have another set of ears in that room, not just the patient's ears, if possible, as a sounding board, and be able to process the information. Be sure to discuss the range of outcomes and continue to discuss the range of outcomes again and again and again and again. I would make sure that you're asking about internet searches and outside information that they're seeking. And of course, you may need to help, especially as a mental health professional. I talk about placing limits on that. Like, where are they getting their information from? I get concerned about some of these, Facebook groups and other things that is not from these more kind of reputable sources. You have to know that. And as you're helping people adjust expectations along the way, focus as much as you can on relative improvements. Again, I think these are all things you all know. I'm just either reminding you or putting it in a framework for you. While we want patients to be attuned to what they're experiencing emotionally, we as the healthcare providers need to remain attuned to what patients are experiencing emotionally. And that means continuing to explore with them and empathize and reflect. Okay, so it comes back to those very basic skills. So coping with recent body image changes. I'm not going to talk about all these different components here, but there's a lot you can do. And I would say any one of these elements, whether it's the gradual exposure and the systematic desensitization to mirror viewing, whether you're engaging them in mind-body relaxation or encouraging them to do this on their own, there's a lot you can do around communication and problem-solving skills, and then helping them be more kind of cognitively flexible. That's important. So in terms of mirror viewing, I would say that you are in a unique position to be able, any healthcare provider is in a unique position to be able to process the patient's reactions to mirror viewing. And even if they're further along in treatment, if you haven't done this yet, you can go back in time and say, what was it like when you first saw yourself in the mirror after your surgery? And then you can ask them, and how has that changed over time? What's it like today? And you want to listen for the words they are using, right? Are they biased? Are they judgmental? Are they emotional? Because one of the things that I do is I often really work hard to try to shift patients' language and reframe into things that are more objective and neutral. So when somebody's using these descriptions of it, the scar is horrible, or it's ugly, or it's disgusting, or whatever it is, I will say to them, look, I want you to imagine that I am an individual who does not have the gift of sight. I am a blind individual. And I want you to describe what it looks like, because I don't know what disgusting or ugly, or I don't know what that is. I need you to give me an objective and a neutral way of describing the way your body looks. And we'll kind of go through that. And that's a really helpful exercise to do. So that's something I would say you can do around that topic. And if you really are able to do a little bit more kind of in-depth work with patients, we talk about this kind of cognitive flexibility and problem solving. You have people who will come in and say lots of social self-consciousness about getting back out there around loved ones and social situations and being around family or friends. Everybody's going to notice. They're going to make comments, they're going to stare at me, they're going to, whatever it is. And a lot of this, like, everyone's going to, or they're trying to tell you the reasons why they're not willing to put themselves back out there in these social situations, because they're trying to predict the future, or they're trying to mind read what's going to happen. And so sometimes it's about labeling those thought patterns and challenging them. And of course, in therapy, you're going to do this in a much more in-depth way, but you can point out when people, I make comments like, I didn't realize you had special mind reading powers, or that, you're clairvoyant, were you born as a fortune teller? There's ways you can kind of point out to them, you cannot predict what is going to happen. Sometimes, that's what's getting in your way. Normalizing and validating the self-consciousness. I work a lot with people on focusing on their nonverbal communication strategies to help them feel more comfortable and confident in social situations. So whether that's eye contact, smiling, nodding, positioning your body in a way that's comfortable, whether that's sitting or standing in a certain way. And these are things they can practice. And as you go into these social settings, if you're focusing on that, I always tell people may notice a change in the way you look. Maybe your weight's changed. Maybe, obviously, if you're going through reconstruction and you're not done with reconstruction, things are not, kind of fully settled out in that way. But people are more influenced by the way you behave than they are by the way you look. and the way you behave and act. And over time, they may notice a change. It could be noticeable, but people can get past that, but you have to give them the chance to. And there might be ways, you can work with people on being prepared for comments or questions. I talk a lot about ways to deal with well-meaning comments about appearance. So we kind of go back to that. Let's take this out of the healthcare setting and into the social setting. Patients come and say, oh my God, people tell me you look so good, or it's so great. You look so wonderful. Oh, you've lost some weight. It looks great on you. Or, oh, you've gained a little weight back and it looks good on you. And all these kind of comments about appearance, which can be very well-meaning and are also kind of automatic. People don't even think necessarily about the implications of that. And I've had patients who have told me, and I've learned a lot from patients over the years who say, this is how I handle it, right? I tell people, like, if you're close enough with somebody and you're willing to be vulnerable with them, you can say, hey, comments about my appearance are really hard to hear right now. Please stop commenting on my appearance. What I would rather you tell me is, it's so great to see you. I'm so happy we get to be together. I'm so happy we get to go do this activity together. And you give them, us as healthcare providers, give patients the language to give to their loved ones, to tell them, please don't say this, say that. And then I also often tell people, and if you don't know somebody that well, just say, I don't want to talk about my weight today. And you move on to talking about, the weather or whatever sports event or entertainment news or something else that's happening, and you kind of deflect. And so there can be ways you can work on this with patients in therapy. Intimacy. Okay, this is a big, huge topic that I'm not going to be able to really do a great deal of justice on, but I wanted to at least address it today and talk about, some important things, both for people in relationships and those that are single or dating. So first, let's talk about kind of partnered relationships. And a big part of this is helping people get back to the basics of communication and really focusing on, a patient who's feeling really self-conscious about their body image changes, being able to understand that sharing and listening are the two things you can do, right? Because a relationship tends to be based on shared interests and experiences as well as trust. And these are not things that will have changed with an illness, and they don't depend on how you look. And so I think all of that self-consciousness about, is my partner going to be, how are they going to feel about the way I look now? Are they going to be unattracted to me anymore? But then the partner is also worried about trying to approach the patient about being intimate or whatnot. What if the patient's not ready? There's a lot that I think gets held back. And the more you share, obviously, the closer you get. It's a wonderful opportunity to grow closer. So it's really important, is just those basics. It's important to be able to acknowledge the physical effects of cancer and its treatment on sexual desire, on sexual arousal, and on energy. These are things that should be discussed with the medical team, because there are medical interventions as well that can be offered. But again, I go back to that kind of those three C's, or some of the other things I've talked about before, which is, don't offer the solutions immediately as a medical professional. First, understand the concerns and how they're playing out. Don't rush into that kind of education, but really empathize and reflect and explore. I tell people, talk about sex. You have to sort out any misunderstandings and fears that you have in a coupled relationship. And then, of course, there's lots of ways that you can create intimate moments without pressure for sex. That can be really important, scheduling those, and know that the end result is not going to be sex in that particular situation. Talk a lot with people about changing up their routines or patterns to fit when they tend to have more energy for sexual activities. So now I'm moving away from, kind of thinking about both intimacy and sexuality here. And of course, the importance of, when things don't go well, regroup and debrief. Talking a little bit about dating, I would just, again, kind of harken back to this idea of body language, and recognizing that you can promote and encourage for your patients a focus on, if you're feeling really self-conscious, focus on your body language. Sit up straight, look in the eye, smile, nod, all of that can be really helpful way to deflect away from all these things that are going on in the back of your mind, all these anxieties and things that you have. And of course, there is no one way to share when, how. It's different for everybody. What I would suggest is this isn't an all or nothing thing. It's not about telling everything all at once, right? I tell people all the time, you can share a little bit, and then a little bit more, and then a little bit more, and allow the partner to ask questions. And don't feel like you have to answer all the questions, but at least it kind of opens up those lines of communication. And of course, be patient, give yourself time. And then again, this kind of mind reading, assumptions, all those things, you got to get into it and make sure that they're not letting that get in their way before they've even put themselves out there. And of course, the important concept of regrouping and learning from different experiences. So in the long term, kind of promoting body image acceptance over the long term, continue to work on this kind of promoting cognitive flexibility, which I've talked about, and I'll talk a little bit about mindfulness and body esteem activities. Look, a big part of mindfulness is being able to observe your experiences without judgment. So we go back to the idea of how do you describe your body when you see it in a mirror, or when you look at yourself in a reflection? Can you do this without judgmental, biased language? That's being more mindful. It's also just about staying connected to the present moment and not focusing so much on what's happening in the future, what happened in the past, but staying true to the present. So any kind of mindfulness interventions can be really helpful for when you're in this phase of promoting on a long-term body image acceptance and awareness. I want to talk about my definition of body image acceptance, and I work with my patients a lot on this. I explain to them that body image acceptance does not mean having to like your body, doesn't mean having to love your body or embrace your body or think your body's wonderful. That's not where I'm trying to get to with people. I'm a realist, and I frame body image acceptance as coming to terms with the fact that there are going to be aspects of your body that you like, and there's going to be aspects of your body that you don't like. And having care and respect for your body despite the changes that have occurred as a result of illness and treatment. A lot of people get focused on kind of, anger and resentment about the way their body has betrayed them. And we have to work through those feelings and come to recognize that there are aspects of the body that an individual can celebrate and recognize. And I work with that a lot. And then being able to cope with the negative thoughts and feelings that you continue to have towards your body, and that's okay. We're trying to hold those things together. So I'm going to try to get through these last few slides because I do have some more information I want to impart. I work a lot with people on building body esteem, right? How much you value your body, how much comfort and confidence you have with your body. We want to increase all of those things for our patients, right? So how can we do that? Well, it's by deliberately planning and being intentional and with purpose, any of these kinds of activities that enhance appearance, activities that are sensory pleasing, and health and fitness related activities. I could give you a number of examples. I would say, kind of starting with the health and fitness activities, they don't have to be intense or prolonged. They could be things like simple stretching, playing with children or grandchildren, walking, dancing, meditating, swimming, gardening. Some examples of sensory activities is anything that activates the five senses. So this is where we think beyond just appearance, right? Listening to music, being outdoors, wearing something soft or silky, watching a sunrise or a sunset, hugging, going for a drive, painting, stargazing. These are all things that people can plan. I would say you get somebody to plan 3 to 5 activities over the next week and which buckets, and then how does it make them feel? And you go over that, right? Appearance enhancing activities. It could be getting dressed up, wearing your favorite clothes, wearing a cheerful color, painting your nails, looking for a nice hat or a wig to wear, trying, something like that. You get people to come up with their own ways of doing this. Okay, so here's what I do now. I focus a lot. My kind of philosophy is I want to help patients face their bodies with greater confidence. So I do provide therapy here in Houston for adult cancer survivors. And note how I frame this for individuals with mild, moderate, or severe body image disturbance, because I do think that patients all along that continuum can benefit. I also do patient and caregiver workshops. I've done groups in the past, not just for breast cancer survivors, but this is for cancer patients, any type of cancer survivor. and we'll provide speaker services. And then for healthcare professionals, I do a lot of research still. I haven't talked about my research programs, but I'm a consultant on a lot of NIH grants, and all focused on when they're looking at body image as outcomes. And speaker services, I can develop tailored patient education materials for groups, and education and training sessions on best practices for body image care. This is my website. I really encourage you all to check it out because there's a lot of information. There's resources. I'm going to have a few quick slides on resources here, and more information on my services and where I'm located. So please check that out. So here's an example where I have kind of body image books. Some of these things are a little bit older, but I would say, you know, the biggest thing that I worked on is this body image care for cancer patients, principles and practices. There's a lot of information for multidisciplinary audience on all kinds of different topics in that book, ranging from children and adolescents to geriatrics to chapters on body image and functional loss, men and body image in couples. There's a lot of stuff in here. I really suggest y'all check it out. The body image workbook is something, so even though it was published back in 2008, that is actually like a self-help book that patients can use on their own. I sometimes pull out some information in there and adapt it for cancer survivors, and I found that to be useful. There's some mindful mirror exercises and other things if you want to check that out. And then here I point out all of the wonderful that you may know of oncology professional societies that have relevant resources and professional support, whether you're a psychologist, a social worker, a nurse. If you're not familiar with cancer care and cancer support community, I encourage you to check out those resources. There's a lot on here. So just go onto my website and you'll find that information. And with that, I am going to end, and I'm going to stop sharing my screen and turn it back over to Elaine, I think.
Okay, thank you so much for sharing this valuable information with us, Dr. Fingeret. So I want to move on to some questions. So make sure you put those questions in the Q&A box. We have time for a few questions, so we'll get to as many as we can. So there was one, since you just showed the screen about books, someone, Gina, mentioned that she recommends The Body Is Not an Apology by Sonia Renee Taylor. Is that another good book that you recommend?
I am not familiar with that, but I am certainly happy to learn from other folks about some of the resources they have. I have another book here I wanted to show y'all. It's called Wig Ed. I don't know if any of y'all are familiar with this. This is by a colleague of mine who is an oncology esthetician. This is great for patients because it gives a lot of information about what to look for when looking for a wig. So we're talking about body image. I wanted to make sure I was able to plug that. Y'all are familiar with this? Very nice. One more book.
Great. Okay, so one question was, what advice would you give to encourage a woman to look at themselves after a mastectomy?
Okay, so I have lots of advice on that because I work a lot in that area on the kind of that coping with recent body image changes. And I would say the biggest thing that I try to explain to people at the outset is the anxiety and fear that you have about seeing yourself after the mastectomy. The longer you wait, the more, as many of us know, it strengthens that kind of fear avoidance cycle. Okay, so the longer you wait, the harder it is to look. So you look as quickly, as soon as you are able to, is kind of the advice that I give people. And I actually had like a little kind of 10 tips for mirror viewing sheet that I had developed when I was at MD Anderson, which MD Anderson now owns. So you can ask them for that, but I can give you some of the tips that were on there. And obviously the first one was don't delay. And I also talked with people a lot about you don't have to look at it all at once. You can start slowly. You can look at a piece of it and then look at more over time. You can do things like take a picture. If looking at it initially is too kind of overwhelming, I would give people alternatives. Take a picture on your phone and then look at the phone. Or I would say to people, if you're not ready to look, take some pictures or have somebody take some pictures and then look at those you want to have that information because, as we all know, so much healing happens. And if you don't really know where you started, you can't appreciate how much healing happens over time. So we talk about that, talk about using a mirror. And I used to hand out, I wish I was able to show you these little handheld mirrors. They were about this big, and I would hand them out to all my patients. And they actually have my little logo on them. They're real nice. And they could take them to the hospital with them, so they wouldn't need to look in like a full-length mirror. They could use a handheld mirror just to look at parts of it. I would also say turn off the lights or dim the lights the first time you're looking. That's another way to kind of gradually, practice relaxation before you start this process. That's probably where I should have started. It's a very anxiety-inducing process for some, is, whether it's soothing music or something that gets you in a little bit more of a relaxed state, and then being really attuned to your emotions and thinking, like, what would I tell a friend if they were going through this? Sometimes you have to put it outside of your own self and into how would I comfort someone else. So that's a lot of tips I'm giving you, but I've thought about this a lot and worked with patients a lot on this.
Well, so along the same lines, then, is there any way to prepare them for body image issues after a mastectomy, or techniques to reduce the body image issues up front?
I mean, obviously giving them some of these tools before they start like doing as much as you can before treatment starts to have the body image effects. But I don't know that the goal is really to kind of eliminate those issues or concerns. Navigating through developing a safe space for them to just talk about and explore and express the concerns, right? Because as we know, they may not feel comfortable talking to their spouse or loved ones. They may not feel comfortable talking to some healthcare providers. So just by giving them that space, and then I think a lot of the things I talked about in terms of managing expectations, right? That kind of speech I would give about managing expectations. I don't think we're going to prevent all of the body image issues from coming up. I think we're just trying to manage them and work with patients where they are at each phase. That helps.
No, I think that makes a lot of sense, because, I believe that we try to prevent so many things from happening up front and help the patient know what's going to come next. And so it makes sense that someone would ask that question. What are some best ways to support mental health surrounding the topics? I think you've talked about this, I think overall, but is there something else you can add to what you've already told us?
I mean, obviously, for those of us that provide the mental health services, make sure that we are being as proactive as we can to put ourselves out there into the community, to make sure that we're making connections with the physicians or other healthcare teams that maybe could benefit from our services. If you're in a hospital or a clinical setting where you can offer those services, being proactive and making sure you make those connections, giving talks, going and, you can go and give talks to the fellows or the nurses, mid-level providers. You can go and be active as a mental health specialist. And if you're not a mental health specialist, but you're looking for those services, I would think a lot of those organizations that I put on that kind of list, there was a bunch of them, on my website, you can connect with national organizations that have those resources that might be able to help. So familiarize yourself with what is out there, and make sure that you have these kind of open lines of communication. But I know for me, I have to step out of my role as a psychologist and only dealing with my peers in mental health or social workers or, other mental health providers. And I've got to go to the oncology groups and say, hey, you guys need, that's how I started my whole body image service. Was I went to the head and neck center, and I went to the breast center, and I went to the reconstructive surgeon center, and I said, you guys need this help. And they're like, oh, yes, we do. And they were all very welcome to have it. But I had to be the one to go and offer it. So I think there's stuff we can do as specialists and mental health specialists to put ourselves out there. We should try to do that as much as we can.
Excellent. Well, Thank you again, Dr. Fingeret, for sharing your expertise and your valuable insights with us today. That is all the questions we have for today. The recording of this program and past programs can be found on our website and our YouTube channel. So be on the lookout for an email for our next Ask the Experts. Let's Talk About Breast Cancer series for survivors in June, and covering all things health insurance. Thank you again, Dr. Fingeret.
Thank you for having me.
Thanks everyone for joining us, and have a great day.